Well, hello and welcome to HealthLine. I'm Jennifer Blomquist. I'll be hosting the program this evening, and I'm so glad you joined us. I wore red because tomorrow is St. Valentine's Day, of course, and we are talking about hearts tonight. We have a cardiologist on. We have not had a cardiologist on this program in a while, so I'm sure hoping that you'll take advantage of getting some great advice. It's timely, considering this is Heart Health Awareness Month. So feel free to call at any time. Again, I'll introduce you to the physician who's been kind enough to come tonight, but we keep that phone number up at the bottom of the screen throughout the program and call at any point. So it's 969-2720. It's a free call even if you're outside of Fort Wayne. Just put 866 in front of there. And then I want to remind you that you have two choices when you call in to talk to the doctor and ask a question. You can do it live. So when you call in, they don't throw you on the air. You will talk to a very nice call screener, and you can tell that person if you want to ask the question live or if you prefer that I ask the question for you. I will say that if you ask it live, the nice thing is that the doctor can interact with you live on the air. Maybe he would need some more information from you to better answer your question. So just keep that in mind. And again, that phone number will stay up at the bottom of the screen throughout the program. So let me introduce you to our guest tonight. He's been on before, but it's been a while. It's cardiologist, Dr. Mark O'Shaughnessy. So thank you so much for coming on.
Thanks for having me.
Appreciate it.
Absolutely.
I think I can't go more than a week without hearing about somebody I know, a friend or a relative having a heart issue. And it just seems to be very prevalent. And I know the field of cardiology, just the offices are so busy, just packed with people. So as we're in Heart Awareness Month, what advice do you give to people in general? You don't think about your heart until you have a problem, probably.
Right. So heart disease is the leading cause of death in both women and men. Yeah. So women think that breast cancer is their leading cause of death. 1 in 7 women will have a breast cancer, 1 in 2 women will have heart disease. And so it's really important that we raise awareness that heart issues are significant. And the majority of what I see are preventable. And so with some very simple preventative type of things, the first thing I would say is know your numbers. Okay. So the causes for heart disease, the risk factors are cigarette smoking. And I'm an unabashed proponent of a cigarette ban, tobacco ban, because we know it causes heart disease. But high blood pressure, high cholesterol, diabetes, and a family history are the things that are the risk factors. And so if you have a family history, you need to know what your blood sugar is, what your cholesterol is, and what your blood pressure is. And a lot of patients will say, well, my family doctor knows that. Well, they probably do. But you can't be part of your health if you don't know what your numbers are. So I would strongly encourage patients to know their numbers and make sure that we're doing everything we can to prevent this disease.
And I've always been under the impression, a lot of the disorders you just talked about, the high blood pressure, high cholesterol, I mean, that usually comes, I feel like, with people who are just thick around the middle. So I was always told, think about the middle part of your body, don't let that get flabby, because that is a predisposition to a lot of those.
So obesity is an epidemic as well, and it is a risk factor for coronary disease, but it is not, it's really, you can't look at somebody's body habits and say they're going to have disease and this other person's not going to have disease. It's really important. I've had people who are rail skinny and have heart disease.
Really? Okay.
And so it's not obesity certainly predisposes a person to having diabetes and high cholesterol, which are risk factors for coronary disease, but just because somebody is obese doesn't mean they're going to destined to have heart disease. And so it's really important that you can't look at somebody's body habits and say, well, they're destined to have a problem. Everybody is at risk.
I was going to ask, are there special tests you should, I know the recommendation is to see your doctor yearly for a checkup. So would you get all those numbers you're talking about from a regular
primary
visit
care
with your primary care? Okay.
Primary care doctor is going to get those numbers for you. They're going to check you, make sure you don't have diabetes. If you have hypertension, you're on appropriate medications, and they know what your cholesterol is. And so those are the 3 major things you can get with your primary care doctor. Of course, cigarette smoking, if you're a cigarette smoker, it's never too late to quit. Do everything we can to get off the cigarettes. And in the family history, you can't choose your parents, and so that's one strike against you. One screening study that would be considered is what's called a coronary calcium scan. Okay. And it's a very inexpensive $50 scan that it takes advantage of the stuff that plugs up our blood vessels. Is very complex biology. we don't fully understand why and what it is. But calcium is an early component of the stuff that corrodes our pipes. And so we take advantage of that. X-rays don't go through calcium, so I can see our bones. We get a CAT scan of your chest. If you have calcium there, you've got coronary disease. And so it's a yes or no screening study. It takes 2 minutes to do. It can be done at any hospital in Fort Wayne. And it basically gets a CAT scan of your chest, no IV sticks, no blood draws. You don't have to disrobe for the screen. It's a really good screening study.
Would you recommend that at a certain age, or if you're having some kind of symptom?
Well, if you're having symptoms, I would certainly check it out with your primary care doctor first. But if at the age of 40, if you have risk factors, we would consider doing it. I wouldn't do it younger than 40, and I wouldn't certainly do it if you're over 75 or 80, because when we do a screening study, we're trying to mitigate risk factors. Well, if you're 80 years old, I want people to live to 120, but there's not much I can do at that point in time to mitigate it. So I would say if you're between 40 and maybe 60 or 70, those are the time frame we'd want to consider doing a screening.
Okay. Right. Tell us the name again. It was the coronary.
It's a heart scan, a heart smart scan, coronary calcium scan.
Okay.
We're just taking advantage of the calcium that's inside the coronary arteries if you have disease. If your score is 0, you don't have disease. If your score is anything but 0, you have disease. It's yes or no.
And how often would you want to do that?
So,
like if it came back fine?
If it's 0, I typically repeat it about every 5 years.
Oh, okay.
I actually use it in the public safety arena. I've been screening the police, fire, and EMS in this little area. They have the same risk factors as you or I.
Sure.
Their on-the-job stresses are way different than the average population. And so in that population, I've been screening them every 3 years just because of risk. But if it's a general population, I think about every 5 years, assuming it's 0. Once it's not 0, you don't need to repeat the scan. It's like getting a colonoscopy. If you have a polyp or not a polyp, it alters your screening schedule.
Okay. All right, good to know. I wanted just to remind everybody that we only have Dr. O'Shaughnessy here until a little before 8 o'clock. The time does go by quickly, so take advantage of getting some wonderful advice. If you have any question cardiology related, I mean, we're talking about heart disease, but if you have other things cardiology related, please take advantage of this guy, because he can answer it, or at least point you in the right direction. Maybe it's not necessarily you, but a loved one that you're concerned about, or a friend, and maybe that you could just offer them some advice or things to think about, tests to think about, stuff like that. So there's the number, 969-2720. Again, outside of Fort Wayne, still a toll-free call as long as you put an 866 in front of there. With this being Heart Awareness Month, good time for maybe people to think about, you talked about changing your habits. I mean, I think some people will roll their eyes and say, yeah, I'm supposed to exercise and eat right. Maybe people don't really know what that is. It doesn't have to be running a marathon. So
exactly, and so I think it's really moving, and I tell people there's not one form of exercise that's any better than any exercise. The one you enjoy doing will be the one that you will do. And so if you like to doing elliptical, or if you like dancing, or if you like swimming, or whatever it is, walking is a great form of exercise. You don't have to go out and run races. You don't have to be an elite athlete. You have to move. And again, never too late to start that either. I have patients who have severe orthopedic issues, and they can still do something. They can still move. And so I think just staying active is important. And I'm a firm believer in a prudent diet. There are a lot of fad diets out there, and I know you've had dietitians on this show to talk about those diets. Quite honestly, we have an obesity problem in the United States. We have an obesity problem worldwide, and it's really our caloric intake. It's not the foods we're eating; it's how much we're eating of those foods. And so I'm a firm believer in moderation. Decrease the amount of foods. Certainly, moderating our fat intake is important. Cholesterol intake is important from a cardiovascular standpoint. But it's more about just moderation and exercise. Is the two things that I think can be a huge step to heart health.
I remember you talked about salmon being so good to eat, and this is a great week to buy salmon. It's on sale everywhere because tomorrow, Lent starts tomorrow. The fish sales, but my kids love salmon. You wouldn't think that kids would eat that, but if you're one of these people that's like, I don't know about the fishiness, salmon. Like I said, my kids all love it.
Fresh salmon.
Yeah,
so,
just put it on the grill. It's really easy.
So when we're talking about fish, we really would like the deep water fish. So cod, salmon, tuna. Those that have a lot of omega-3 fatty acids, the fish oils. So, you can supplement fish oils with fish oil capsules, but actually eating the salmon is taking away something else from your plate, typically a red meat. And so it's nice to be able to have a fish instead of that. And it doesn't have to be every night. Again, I'm a firm believer in moderation. People can splurge every now and then. If you want to go out and have a steak, that's fine. Just don't do it every night. If you want to have eggs, that's fine. Just don't do it every night. So I just think moderation is the key.
I'm glad you said that, because I think people, I feel like when I've watched other people try and go on these diets, some of them fad diets, when you are so restrictive with yourself, then it doesn't last, and then you just go back to bad habits.
You go back to, it's a yo-yo kind of a thing. And so the fad diets work, and if you look at the fad diets, every one of them work by caloric restriction. You take an entire chunk of the food chain off the diet, you're going to lose weight because you're not eating as many calories. And so that's really how they all work. And I know that people are selling books because they show their diet does this or that.
Yeah.
It should be sustainable. It's literally lifelong. I mean, I like to get to kids and have them, starting exercise and dietary things, because it's a lifelong thing that we really want to maintain heart health. And it's easier to have a lifestyle rather than trying to change a lifestyle. Once you have an event, you have to change your lifestyle, and that's really hard. And so we'd like to have it start early on and maintain it throughout the rest of your life.
Yeah, I was going to say, and I've seen this, witnessed this firsthand from friends and family, but somebody will have, go into cardiac arrest or have something horrific happen, and then it does have a big impact on the people around them. I'm shocked. I'll see them, out biking instead of driving, and they'll talk to me about, now, the whole family, we decided we're doing this. I mean, it's sad, but it's scary when you have something that traumatic happen.
Cardiac arrest is the worst possible outcome when it comes to heart. When we talk about heart attacks are caused by buildup of fat and cholesterol inside the tubes that supply our heart. And when you close off that blood supply, the muscle below doesn't get the nutrients it needs, and it has a very short time to be able to get the muscle open. Cardiac arrest is where the heart's rhythm, the heart quivers and stops. And that's a fatal problem if you don't get resuscitated quickly. And so it's very important. If somebody's having symptoms, recurring symptoms, they need to get checked out.
I was going to ask you about the symptoms and if they differ, by age or men and women. Because we always think about, I don't know, in the movies, you'll see the guy holding onto his chest, but I've heard people say it's actually sometimes feels more like it's in the center or like by their stomach.
Right. So classic heart pain is an elephant standing on my chest or a bear hugging me, going down my left arm, going to my left jaw, shorter breath, sweaty, sick to my stomach. Less than half the patients present with classic angina. It's more common not to have those. Women more so than men have atypical symptoms. And so my rule of thumb is if you're having a recurring symptom from the waist up, it needs to be checked out. It may not be heart disease, but if it is and we wait too long, then it's a real problem. So it's critically important. Waist up, recurring symptom, get it checked out.
All right, never hurts to be safe than sorry. So we have somebody who'd like to ask you the question live, doctor. So Kevin, are you still there?
Yes.
Hi, thanks for waiting. Go ahead with your question.
Okay, my question is about blood pressure. And I've been through the scans and the stress test. My blood pressure was getting up as high as 190 over 145. They said they could find absolutely nothing. And they thought it might be attributed to a traumatic brain injury I had or a spinal cord injury. And now I'm at a loss at which direction to go. Do I see a neurologist or should I continue with a cardiologist? Because they just dumped me off and here I am. Well,
so it's really important that we get that blood pressure under control. That's going to be critically important. Now, there are a lot of things that can cause high blood pressure. The most common cause of high blood pressure is called essential hypertension. There's not one specific cause for it. It's just the blood pressure goes up. Brain trauma certainly could, but that's not necessarily. You still need to treat the blood pressure. So we need to find a medication or combination of medications that are going to control your blood pressure without causing side effects, because high blood pressure in general doesn't cause symptoms. And so if I give you a pill with side effects, you really don't want to take it. So it's very important that regardless of the cause of it, even if it's just essential hypertension, it needs to be aggressively treated. So I wouldn't let them off the hook. I would say just keep working to try to get that blood pressure under good control.
Kevin, did you want to ask Dr. O'Shaughnessy anything else?
I think that'll do it.
Okay. Well, best wishes.
Good luck. Yes.
Direction. So
Yes. Good luck with it.
All right. Thank you.
Mm-hmm.
Sure. Best wishes. Yeah. Sometimes you just have to be an advocate for yourself.
Absolutely,
I mean, some of these
100%.
offices are swamped.
They're swamped and it's really busy, right?
Yeah. No, I'm glad he asked about that. That's awfully high too. That blood pressure.
Yes, it is.
That's concerning.
Is.
Somebody called and wanted me to ask the question for them. It was Leah, and she was talking about that Heart Smart test that you were talking about, like a CT of your chest. She wants to know if you need to have a prescription to get that test?
Great question. So in the past, no, we were doing it, but unfortunately we had too many people who shouldn't have gotten the scan to get the scan.
Okay.
So now you do need a prescription, but you could talk to your primary care doctor and they'd be happy to order that scan for you. It's you know, either any hospital in the Fort Wayne area can do that. So just talk to the family physician and they can order that for you.
And you said it was, what, about $50?
It's $50 scan.
Okay.
Yeah, it's $50 scan. It takes 2 minutes to do.
Yeah.
Totally painless.
Yeah, I had not heard of that, so that's a great thing. Think about that. That'd be a great gift to give to somebody. Hey,
for Valentine's Day, that's
why
right,
spend $100 on roses? They're going to wilt in a day. Although the women are going to get mad at me, but this is something they're thinking about. You, love you, want you to be around for a long time. A thoughtful gift. Let's see. We had another person call. Tom wanted me to ask you, how long will a heart bypass last?
Great question. So when we talk about heart bypass, basically it's due to you have blocked arteries. The highways are closed, plumbing is closed, and so they bypass that. And so typically the bypass grafts can last forever. But the problem is we can have progression of disease, which means that the stuff that caused the fat and cholesterol to build up in the first place can progress. Now we do everything in our power to make sure that we mitigate risk factors, keep your cholesterol down, your blood pressure under control, your sugar under control, stop smoking, exercise. But even in that, some people will unfortunately have some progression of disease. But with today's technology, I mean, I've seen bypass grafts that are 25 years old that look pristine and brand new. So they're not destined to have bypass graft dysfunction over time. And so we will get a dreno for the blood vessel at some point in time. We don't have that today, but something that dissolves that stuff out of there. And so, but right now, I would say that, you know, bypass grafts, I wouldn't put an expiration date on them at all. I think that, you know, we'll see, you know, if you do aggressive modification of your lifestyle, it can last for decades.
Wow.
Yeah.
That's longer than the orthopedic hardware that we talk about, and that stuff's really expensive too. So good to know it has a long life. Let's see. Sarah called and wanted me to ask you this question. She said her mother has high blood pressure overnight, so she's taking medication to help. Is there anything else she can be doing? I
think it's most important to take the blood pressure medication and make sure that the blood pressure is staying down. It depends on the age, so I'm a little bit hesitant to, optimal blood pressure is less than 120/80, and that's the current goal. But when our patients get older, in their 80s and their 90s, dropping their blood pressure too low, sometimes all of us had experience when you stand up quickly, you get that dizzy, lightheaded, feel lightheaded. And so if we do that to elderly patients, we're going to potentially cause them to pass out.
Right.
So if we have a decent blood pressure control, then that's what we're looking for. If it's overnight, like it's during the nighttime hours, then you take her blood pressure medication in the evening before she goes to bed. If it's during the daytime, you take it during the daytime, try to get better blood pressure control. So you try to modify the schedule of the medications to control the pressures when they're having high blood pressure.
Yeah, I was going to ask you, is that typical for people just a certain time of the day to have the issue, but then the rest of the day they're fine? There's
a circadian rhythm to our blood pressure. It's normal, so our blood pressure will go up and down throughout the day. And so, and some people they will. And so what I will do, if they say my blood pressure is always up at night, then I say what I would do is just shift their blood pressure medications to the afternoon or evening so I control it, because most of the blood pressure medications have a half-life. And so it will wear off over a period of time. And so we try to control their blood pressure when it's at its highest point. And so just really talking to the primary care doctor and managing that blood pressure at the times the patients are having it.
And, you know, I wanted to say, you know, Sarah was talking about taking care of her mom. You know, if you've got an older mom or dad who's on this having heart issues, I mean, sometimes, you know, you have to monitor it, you know, especially if it's somebody who might be, you know, not remembering to take their medicine all the time.
Absolutely.
Or maybe, you know, they just don't want to. And so sometimes I would feel like a family, like a child or a close relative could help in that situation.
It's hard to take any medications, really, and quite honestly, taking medications multiple times a day is very difficult.
Oh, yeah.
So we try the best we can to, number one, use generic medications because cost becomes an issue. We try to use medications that are at the most twice a day. If you do 3 or 4 times a day, it's just not, patients can't be compliant. It's just too often to do that. I have patients who we're literally setting alarms to try to take their medications. I say, please don't do that. Let's make it easy on you and try to make it cost effective. And again, I want to get the pressure down. I want to control the risk factors, but I don't want to break the bank in the process of doing that.
Yeah. Well, and that just decreases your quality of life too. 100%. You know, when you're living around the clock, thinking about when you take your pill next.
Absolutely.
You know, so.
Absolutely.
We do have a few minutes left, and so I just want to remind everybody we've had some great questions. I appreciate everybody for calling in tonight, but you could still squeeze in a few more questions here if you want to give us a call. It's 969-2720. Again, anything cardiology related would be more than welcome, so feel free to call. We just have a few more minutes left. One thing, we've talked about this, but it's been a really long time ago, and I think it was either you or one of your colleagues had referred to the heart as a sympathetic muscle. You know, we talk about having a broken heart, but I feel like there's so much stress going on in the world. We were talking before about how you can't post anything online without making somebody mad. Yeah, does that literally, it sounds like it literally could take a toll on your heart when you have stress, especially most emotional stress. How do you handle that?
So you know, we've gone back and forth about stress as a risk factor for coronary artery disease, for blocked arteries. But there is a diagnosis called Takotsubo cardiomyopathy, and it's basically broken heart syndrome. It's a stress-induced cardiomyopathy. And so what a person gets in severe emotional stress, loss of a loved one, house fire, something like that, they will actually have what appears to be a heart attack. The entire front of their heart stops moving. They have chest pain. We do a heart catheterization, there's no blockages at all. And so it's really unusual. When I was in training, we would see Takotsubo once or twice a year. We see it several times a month now.
Do you?
And I think it's related to the fact that our lives are way more stressful. We're at a very fast pace, and I think it really creates problems. So how do I deal with it? Much more challenging problem. Trying to reduce stress is difficult.
Well, you know, having a good, you know, foundation, you know, base of friends and family is supportive. You know, it helps to pray, you know. I mean, you know, I can't tell you how many people I've met that said faith has been a great medicine for them.
100%.
So something to think about. Let's see, Bob called in, and he's on the line waiting to ask you the question. Go ahead, Bob.
Well, I have a defibrillator in, and I was wondering if you could kind of explain it. It did go off on me on that last summer, and man, it really went off. It was like a ton of bricks hitting me in the chest, and so I was wondering if you kind of explain that.
Sure. So defibrillators are devices, fancy pacemakers, that are monitoring your heart rhythm, and they're looking for you to have an abnormal heart rhythm. Specifically a rhythm coming from the lower chambers, which are life-threatening, called ventricular tachycardia or ventricular fibrillation. And so the pacemaker defibrillator is a guardian angel, and it's watching your heart rhythm. And if you happen to have a bad rhythm, it will initially try to pace you out of it. If it can't pace you out of it, it'll shock your heart out of it. And it's like an elephant kicking you in the chest. I mean, when you least expect it, it's there, but it's a life-saving device. It has backup pacing as well, but it's critically important to maintain that, because it's a life, even though it's uncomfortable to get shocked, it just saved your life when it did that. So that's exactly what it is. It's basically a guardian angel watching your heart rhythm. If you have a bad rhythm, it'll shock you back to normal rhythm.
Bob, did you want to ask anything else real quickly? We've got a couple minutes.
No, he answered it. He answered it really nice.
Okay, thank you. Thanks for calling.
You.
Happy Valentine's Day.
Happy Valentine's Day.
When that happens, should you let your doctor know?
Yes. So if our patients get shocked, they'll give us a call, and then we can interrogate the device, make sure that there was an appropriate shock. Rarely, these devices are very sophisticated. Rarely will be an inappropriate shock. If it's an appropriate shock, and it happens once, we say it did what we wanted it to do. If it's a recurring theme, it's uncomfortable to get shocked, then we adjust our medications.
Okay. I did not realize that. My mom has one of those, actually, but she's not had a shock. She just got it last fall. So
my mother had one as well, and she got shocked in the grocery store with my wife, and she let people know that she got shocked.
Okay, well, I'm glad, Bob. Thank you, because now I'll be more aware when around my mom. So we do have time just for this quick question. Patty had called in, and she said she went in for surgery, and they said she might have a heart murmur. Is that something that she's got to worry about, I guess, getting treated? Or
just evaluated. So a heart murmur is a sound I hear with my stethoscope. A murmur is just sound that we hear a flow going across a valve. And so the only thing we would do is we would first off, you can see a cardiologist, or your primary care doctor might just order an echocardiogram, an ultrasound of your heart. Look at the valves, and most murmurs that we hear are flow murmurs. They're just flow going across a normal valve. Pathologic murmurs are actually going across an abnormal valve, and those are the murmurs that we would want to be aware of and see how, make sure that there's not a major problem. So an echocardiogram would be very reasonable.
Okay. Is that going to be like a complication for medical treatments?
Should not.
It should not. Okay.
No. It really, if they get the echocardiogram, she could easily have her surgery, or even just see a heart doctor, and we could tell whether it's a flow murmur or not.
All right. Well, this is going to be our last question, and it's a good one. I figured somebody would call and ask, how much wine could I have each night? So we only have 30 seconds left, but she just wants to know, is that heart healthy to have maybe a glass of red wine?
If you're not a drinker, wouldn't say to do it for heart health. But in moderation, a glass of wine a night is very reasonable.
Okay.
Yeah.
At my house, we're having sparkling grape juice tomorrow night, red and white, but it's the thought that counts.
Yes,
so
exactly.
I figured we'd get a question about the wine. Sadly, our show is over. Dr. O'Shaughnessy, sure appreciate it. It was great to see you.
Yes.
Hopefully have you back sooner this time compared to the last. So thank you so much to all of you for watching, and your questions were great. Really appreciate that, and I know people got helped a lot tonight. So hey, I want to remind you too that if you want to just see clips from the show, you can go to YouTube. They post like 3-minute clips, and if you want to find out more information, just go online, YouTube. Have a good night. Have a happy Valentine's Day. I'm Jennifer Blomquist. Take care.
The preceding program on PBS Fort Wayne was made possible in part by...
It's a new day at Parkview. Another day to rise up and make life better for those around us. Whether that means pushing the boundaries of what's been possible, taking big strides, or sitting with a patient long after a shift has ended. At Parkview, we don't just do what's expected. We do what's best for you and your family. And we're determined to do it even better tomorrow. Every person, every day. That's the kind of healthcare we believe in. Parkview Health. We believe in better.